Hello.
Hello. So happy to be here on a Wednesday afternoon. Well, evening for you, afternoon for me. Meris rushed home from the hospital after working a shift so
Yes,
that she could be here.
I'm still in my scrubs, so I booked it home and so that I could hang out with you guys. Very excited. We're gonna play Nurse Squad today. We're gonna play the NCLEX-prep version. We're gonna be studying for NCLEX, reviewing everything that you have learned. It's gonna be a blast.
Totally. And I'm been filming all afternoon, so I'm still in my lab coat. So because I do a little more filming after this, but I'm excited to take a break. And if you haven't been to one of our last NCLEX prep sessions, then I'm so glad that you joined us today. And we'll tell you what's going on with Nurse Squad. So how many people have joined us before? How many people are familiar with our Nurse Squad card game? This is a great review game, and we've got a Nurse Squad game for all of the different subject areas. So med-surg, maternity, peds, nutrition, psych, everything.
Wherever you are in your program, we've got a Nurse Squad to help you out. So like Cathy said, but all the way from health assessment up through your specialty classes. And as you can see, some of them are like, this is nutrition. This is a pretty skinny one. There's, there's not tons and tons of content. However, compare that to like med-surg, right? This is nutrition, med-surg. Look how much bigger. So that's because you have a lot more to cover. So we made sure to give you that information to be prepped. The other thing is, if you haven't played Nurse Squad before, you can see that our cards, they tell you what subject we're talking about. Health assessment, for instance. Health assessment doesn't have different sections, but like funds, this is a leadership question. It tells you that it's for leadership, and then it tells you exactly how many points it's worth. So obviously 1 point questions are going to be the easiest, 2 is in the middle, and 3 points are the hardest. But there are 2 questions on every card. And the way that it's played is we would decide, but I'd say, hey, Cathy, do you want to play the top questions or the bottom questions? They are similar, but not the same. So they might be asking like, I had one that was talking about TB, right? And so the top one had something to do with TB and the bottom one had something to do with TB, but they're different questions so that no matter which one you're playing, you get a unique question that covers all of the information you need to know.
Totally. And in some of the games, like med-surg has a huge stack of cards with review questions. And then each card, like Mara said, has 2 questions. So you get a lot of questions. You're going to have to spend a lot of time with this game before you would end up having a repeat question. So, and then if you know us here at Level Up RN, you know that the questions that are in these games are the things you really, really have to know and that you are likely to get tested on. So
yeah, our time is precious and your time is precious. So we're not in the business of wasting anybody's time. So totally. If it's on, if we are asking it, it's because you have to know it. We're not going to waste anybody's time with little fluffy garbage that might show up on one sentence and one page of one chapter of one textbook. No, we're not wasting your time with that. It's the got to know it stuff only.
Totally. So here's how things are going to work today. So first of all, I just wanted to let everybody know, especially for new people or just new to Level Up, that we actually have a special promotion going on our website, such that if you buy our nursing school survival kit, you get to choose a free planner or a free dosage calculation workbook. So that is only good through the end of the month, is my understanding. So that's a special promotion. So definitely, there's the planner.
There's the planner.
You have the dose cup.
We, of course, have our Dose Calc.
Nice.
So
Yay.
very similar looking in terms of how they're bound and everything, but very different products. Both of them are fantastic. This one will help you get organized. This one has reference material to carry you through all of it. I mean, it's really awesome. Like, you don't have to keep Googling these lab values. We've got them all in one spot for you. Room for you to plan your clinicals, your labs, simulations, to pay attention to what like assignments are coming down the line. There's a lot of great stuff in here. Pep talks, studying, test taking, and clinical tips. Like there's a lot of great stuff in here. And then dosage calc, whether you are just starting out in school or you are at the end of your program, this book is for you. We cover everything from conversions, like the bare basic conversions, all the way to titrating critical care medications.
Totally.
So even if you're like about to go into practice, this is still a great book.
Totally. And so that's an excellent promotion. You should totally take advantage of that. And then in light of that promotion and just kind of highlighting those two amazing resources, we're going to do 2 giveaways today. So partway through, we're going to give away a planner. Okay. So you guys will get to pick whether you want an academic year planner or a calendar year planner. And then we will also be giving away a dosage calculation workbook during this session. So not only are you getting to study for NCLEX or for your classes, but we're also doing these giveaways. So hopefully you will get to win one of these awesome things.
Yes. And if you win and you already have one of those things, we will make sure to make it right with you. Don't worry. So go ahead and enter, even if you've already got one of those things.
Yep. And oh no, CD. Sorry, I won't be able to participate. I got a job, so I'm on my way to work. No, so CD is. Oh,
I know.
So the way Nurse Squad works when we do this online, we divide you guys up into 2 teams, like Team Cathy and Team Meris. So if your handle, like your username, starts with an A through an L, then you are Team Cathy. So usually CD is Team Cathy, right? But I don't have CD, so that's fine. We've got lots of other people out there who are going to help Team Cathy like get there over the finish line. And then everybody with a handle name of M through Z is Team Meris. So we break you guys up into 2 teams. So let us know in the comments which team you guys are on. Okay. So
put it right here in case you missed that or you need a refresher. If your handle starts, your handle, not your name, but the thing that we can see that says, like
totally.
CD, if that starts with A through L, you're on Team Cathy. M through Z, you're on Team Meris. Put it in the comments so we can double check and make sure that we all know which team we are on.
Okay. And, everybody, so if you're on, like, if the question's for Team Cathy, anybody with that handle A through L, just put your answer in the comments. It's a big group effort. We just ask that you don't like Google the answer or cheat, because that's not very fun or helpful. So just put your answer in a comment. Don't Google anything. We'll kind of keep track of points and then add up all the points in the end. Is there anyone out there who hasn't played before? Because I want to just do like a little brief description, give you guys a little bit of information about what you can expect from the Nurse Squad game. All right. So yeah, Team Cathy, Team Meris, Matthias, I passed NCLEX with 85 questions. Thank you. Level Up RN. Yes. That is awesome. And you're here to play some more. I love it. That's fantastic. Okay. Team Cathy. Someone asked if they should be a CNA before starting nursing school. It's super helpful. I mean, if you can swing it, it's great experience.
Don't panic if you aren't, if you can't. Like, I was never a CNA. I was a medical assistant. I did EMS, phlebotomy, but I never was a CNA. So if you can, that's awesome. You'll get great experience. If not, there's lots of other ways to get good experience for nursing. So don't panic.
Yeah, totally. Okay, so there's a couple people who it's their first time. So this is a Nurse Squad game. This is the fundamentals one. And what you can find in the game, first of all, the box is like super solid, like magnetic, really high quality box. Yeah. So you kind of have a how to play. There's lots of different ways you can play the game. You can play collaboratively or competitively. We're all about the competitive play here on Nurse Squad
And
Live.
there's a QR code. So this is a little booklet that tells you about how to play, but there's a QR code at the back, and if you scan that, it will take you to a site that has like video tutorials, different ways to play, you know, different gameplay instructions and more stuff like that. So if you're like, I don't really understand how I'm supposed to play this, I read it, I don't get it, go scan this. We've got videos showing you how to do it.
Totally. So you've got the instructions. We have our avatar cards. So if you want to play as someone you kind of relate to or aspire to, you can totally do that. So we have our typical people we usually play, but sometimes we change it up. You going for your
I gotta go Willow the Wiz. She's my favorite. I mean, she just looks like she's got it handled. She's got it on lock. And then my favorite is, so this is the like student side that shows like when they're trying to join the level up nurse squad. And then when you win, you level up and then you get to become the nurse squad. Like this is her as the nurse squad character. And I just think she looks so like, look at her. She's ripped. She's looked like she's got it handled. She's not worried about anything and she's ready to take it on. So I love her.
That is awesome. That's awesome. All right. I'm going for Izzy. Izzy, you know, she's got the guns. She works out.
Look at her. Yeah. Look at that pose, that power pose. Like,
I know, right? So I'm going to play as Izzy. And then, of course, we have all of the question cards, right? So as Meris was showing you earlier, like here's just like half of the fundamentals cards, and then there's 2 questions per card. So we have all the question cards. Mm-hmm. And tonight, since we're playing kind of an NCLEX review session, what Meris and I did is we took cards from all the different games. So we took some from MedSurg, just as Meris is showing you. We took some from funds, from nutrition, from all the subjects. So you're going to get a variety just like you get on the NCLEX. And then the only other thing I wanted to highlight in the box are hazard cards. Okay. So since we play competitively here, we usually always throw a hazard card on the other person. So basically what that means is when I play a hazard card against Meris, that means that Team Meris has to answer the next question correctly. If they do not answer it correctly, then they will lose 4 points. And if they do answer it correctly, they get 0 points. You know, they don't lose any points, but they don't gain any points. So you kind of have to be strategic about when you want to play it. Like I got to wait for like a 3-point nutrition question or something for Meris. Like I'm not going to play a hazard on Team Meris when it's like a maternity question, because that would be stupid of me. So
I just had to show you, Cathy, look at that. Our friend June passed NCLEX.
Yes, congratulations. That's fabulous. That is fabulous. And you know what else I really love? I love that all the people that we've helped and that have passed their NCLEX are still coming here to play tonight.
Oh.
So you're not done with us. I love that. You want to stay and hang out. Totally. So that's how Nurse Squad works. So let me know in the comments if you have any questions, but basically we're just going to take turns and, you know, asking each other questions, and you guys are going to need to answer them. So we can give some hints sometimes, right? Some clues to help you, but you guys got to answer the question. Okay. So do you want me, I don't know who went first last time. You want me to ask you? Let me ask Team Meris first?
Sure. Yeah, that's right. Where's my thing? Okay, there it is.
All right. So first question for Team Meris. You guys ready? So if you have a handle name of M through Z, this is your time to answer this question. If you're A through L, like don't put it in the comments because they have 60 seconds to get it right. Okay, this is a 1-point labor and delivery question. So a patient is 9 centimeters dilated and says, I can't do this anymore, and reports the need to have a bowel movement. The nurse knows that this is which stage and phase of labor? You need the
Okay.
stage and the phase.
We are looking for a stage and a phase of labor related to a patient who is 9 centimeters dilated, feels like they need to have a bowel movement, and is saying, I can't do this anymore. So part of what we just got is correct here, right?
Well,
What Shannon said?
yeah, okay, there, yep. So yep, actually, so yes, I think I saw first stage transition phase. You got it.
Yes.
Sorry,
So
I was looking through
remember,
the comments, trying to find
yes.
the right combination.
So stage 1 is going to be from the onset of labor to the delivery of the baby. Okay, so that is going to be stage 1. Stage 2 is going to be from the delivery of the baby to the delivery of the placenta. And then stage 3 is going to be from the delivery of the placenta until the stabilization of the maternal patient. So stage 1, though, has 3 phases inside of it. So then you end up with, you have LAT is how I remember. I just remember lat. I don't know why, because it kind of makes it, like, it doesn't mean anything. It just, like, stuck in my brain. So you have latent, active, and transitional. Transitional, the thing you need to know is when they are telling you, I can't do this anymore, I'm scared, I changed my mind, like anything like that.
Poop.
Yes, or I feel like I have to have a bowel movement. Yes,
right.
That means baby's coming, like right out.
Yep.
So
totally. And those, I totally got tested on stuff like that. That is a huge characteristic of that stage. So, all right, well, good job, Team Meris. Congrats. All right,
you ready?
Team Cathy. Now it's our turn. You guys ready?
This is a 2-point fundamentals leadership question. Okay. Here we go. Which of the following should the nurse not delegate to an LPN or an LVN, wherever you are? Okay. Blood transfusion, tracheostomy care, wound dressing change, NG tube insertion. Select all that apply. Okay. Blood transfusion, tracheostomy care, wound dressing change, NG tube insertion.
All right. Which of these should an RN not delegate to an LPN?
Yes. Winnie, you are on my team.
That's all right, because whoever answered the last one was on my team too. So, all right.
Really? Yes. So blood transfusion. I tried to trick you guys by saying select all that apply. Because remember, on NCLEX, they can say select all that apply, and it can be just one thing. So don't let yourself get tripped up. But yes, blood transfusion.
Awesome. Good job. And as a reminder, if you're Team Cathy, don't answer Team Meris stuff. Okay. All right. I've got I have a 2-point endocrine system question. Okay. From MedSurg. You guys ready?
All right.
What is one finding the nurse would anticipate if a patient is experiencing a cerebrospinal fluid leak following a hypophyseectomy?
Okay.
What is one finding that the nurse would expect if the patient is experiencing a cerebrospinal fluid leak following a hypophyseectomy?
Mm-hmm. Okay, so CSF leaks. How do we know if a patient is leaking CSF? Is the way I want to word that.
That's good. You didn't give away anything.
I didn't give it away. Yeah. Headache works, right?
Yep, headache works. I want to hear some other ones too. You guys got the point. You got, actually the 2 points, sorry. But yes, halo sign.
Yes.
Halo sign.
And I love that you said glucose too.
Yes.
Because what might your patient say? They say, I've got a runny nose and, Matthias, you got it, clear fluid from the nose, but they're going to say that it
tastes How will glucose taste? It'll be sweet, right?
Sweet, yes.
Totally.
Yep. So
Here,
halo sign is just in case we're not familiar with halo sign. So this is like specifically if we're talking about when it's mixed with blood, but you can also see this regularly. If we have, if I have some drainage coming from the nose and I take like a piece of gauze and I put it, I just place it over there and suck it up, you will see a halo, like a ring around that center thing that's showing the CSF separating out from the blood or from the nasal drainage or whatever it is. So halo sign is what you're looking for there.
Totally. So yeah, so the answer was any of the following: a halo sign in the drainage, which is clear in the center, yellow on the edges, sweet tasting drainage, the presence of glucose in the nasal drainage, or a headache. So nice job, y'all. Very good job.
I love it. You guys are so smart. All right.
Team Cathy.
2-point cardiovascular. If your username starts with A through L, this is for you. Team Meris,
Yes.
Zip it.
We're ready.
Okay. This is 2-point cardiovascular. What disorder is characterized by abnormal hemoglobin, increased blood viscosity, blood flow obstruction, and tissue hypoxia?
That's a good one. This is a good one. Okay, what disorder is going to cause those things? Blood flow obstruction, hypoxia. It causes a lot of pain. They can have, I'm trying to not cheat. I'm trying to give hints without.
There's this condition disproportionately affects a certain racial group, ethnic group.
Yep.
You're thinking on the right lines, June. I like that idea, but it's the abnormal hemoglobin that I would really focus on.
Yep.
Yes.
Yep. So sickle cell anemia. Sickle cell anemia. And individuals with sickle cell anemia will often experience crises. Okay. Does anyone know kind of what the name of the crisis would be if they have like severe pain? Like when they have severe pain and they come to the hospital and you have to get them opioid analgesics because the pain is crazy intense. What is that crisis called that you definitely have to know about sickle cell anemia?
Yeah, that will come up, and you need to be able to identify that without the disorder. Like they could say, a patient experiencing vaso-occlusive crisis. Yep. So yes, so they could say on NCLEX, the nurse is caring for a patient experiencing a vaso-occlusive crisis. Which of the following, blah, blah, blah. And they never say the words sickle cell anemia.
Sickle cell anemia.
So you've got to know. But yes, I like that you guys also mentioned here, like splenic infarct. There's acute chest syndrome. There's a bunch of different
There's like 5 of them. There's like a lot.
of sickle cell, like different types of crises. But vaso-occlusive is the one that they bring up most commonly on NCLEX.
Okay. Yep. Good job, guys. So, hey, before we ask the next question, why don't I have you guys take a moment to enter our contest? So, like I said at the beginning, we are first giving away a planner, which our planners are amazing. And you can pick, if you're the winner, you can pick whether you get an academic year planner or a calendar year planner. That will be your choice, okay? So if you want to win a planner, then in the comments, you should enter one time. If you do it multiple times, then Angelina throws out your entry and you will definitely not win the planner, okay? So only enter one time and put in the comments, let's get planning, exclamation point. So let's get planning with an exclamation point. If you leave off the explanation, we're not going to throw out your entry, but we like the explanation point. So,
disqualified.
Right, totally. Let's get planning. And put it in there. Yep. And then while we'll give you guys a minute or two to get your entries in while we continue playing, if that sounds good. So I've asked you 2 questions. You asked me?
I've asked you 2 questions. Yep. So
okay. Sorry. So it's your turn. Okay. All right. So we have a psych disorders 1-point question. Guys ready?
Oh, yeah, we got this, please.
Okay. A patient with schizophrenia repeats back the exact words they hear. This is an example of what type of speech alteration? All right.
What type of speech alteration is it when a patient repeats verbatim like a thing? So if Cathy said, "Hi, Maris," and I said, "Hi, Maris," like that kind of a thing. Echolalia. Yes, good job.
Yep.
Yes. So
Echolalia.
echolalia, echolalia, echo, right? If I say hello, 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 right? It's repeating the thing that I just said. So yes, you guys got it.
Hey, nice job. That was super fast. Way to go.
Yeah, you guys are on it.
Totally. All right, we're ready for our next question.
2-point practice and skills question. Which kind of transmission precautions? This is so easy. Why is this even a 2-point question? Which kinds of transmission precautions are required for a patient with tuberculosis? Every single one of you better get this one right.
Right.
You gotta know
what kind of precautions do we need for tuberculosis?
And you know this. And you must know this.
100%. For sure. There's always like a little.
There we go.
There it is. Airborne. Nice job. Hey, so just as a follow-up question, what are some other disorders that require airborne precautions?
That's a great question, Cathy.
I know. There's a few others that you definitely need to know. So what other disorders require airborne precautions? This isn't for points. This is just for like studying for NCLEX and just because it's important to know. So
yep. Chickenpox, varicella.
Yep. Measles.
Very good. Yep. What about something that's like, I don't know, kind of a big deal right now recently in the news over the past couple of years?
COVID.
SARS?
There it is.
Good answer. Yes, COVID. COVID-19. Nice. You gotta have the your full N95.
All right.
You guys are so smart.
All right. We have a winner. But first, before we announce the winner, if this session is helping you, if you're enjoying playing this game, if you appreciate these sessions, then definitely hit your like button and let us know in the comments too. For sure.
It helps us out a lot. It lets us know that you like this, and it helps us be more, it helps us show up more and be more engaging with everybody else. So truly, I know it sounds silly when we ask you to like it, but it really makes a big difference to us. So thank you for taking the time to do that. We appreciate it.
Totally. Okay. We have our winner of a planner, and our winner is Fatima Ahmed. So you have won a planner
right in there. So I just put it in the comments. Fatima, send us an email, support@leveluprn.com. Let us know that you were the winner, and they will get that to you. Okay.
And just let them know whether you want the calendar year or the academic year, and they'll get you all set up. Okay.
All right. Congratulations. NCLEX next week.
That's exciting. That's exciting. So all the feedback we've gotten so far is that people really dig the new NCLEX, and I'm like a little jealous about all that partial credit and stuff that I did not have when I took the NCLEX. So that's great. Well, good luck to you. We know you'll do great. All right. I'm at 3 questions. How many?
I am also at 3.
Okay. So it's your turn. We're going to ask you a question again. Team Meris. Okay.
Yes. Also, I just wanted to say, I just updated the banner, but Angelina said that you also get 6 months of free membership with the current promotion here. So if you are looking to get this Ultimate Nursing School Survival Kit, you want to do it now, because you can get this. You can get the planner or dose calc and 6 months of membership for free. So that's a huge deal. Yeah.
For sure. No,
I didn't even know that. Yeah.
Reminding us about that, because that's a really huge deal. For sure. Okay. I have a 1-point health assessment question for Team Meris. So Team Cathy, just M through Z. Okay. What finding does the nurse expect when percussing over a hollow organ? What finding does the nurse expect when percussing over a hollow organ?
So a hollow organ, such as the stomach, is a good example. Somebody who hasn't eaten, they're hungry, you percuss over the stomach. So dullness, you would expect to hear over a solid structure. So resonance, I love the way you're thinking, because when we percuss over like air spaces of the lungs, we're
there
going to
it
get
is.
resonance. But timpani, and think of timpani like the big drum, right? A timpani drum, where we use the mallets to play it. That is the same word, right? Timpani of or related to a drum is what it means. So yes, think of that hollow organ like a drum, like a timpani drum. And if you percuss over that hollow organ, you get a much more drum-like noise than when you percuss over lungs. Lungs, you're going to get that resonant noise where the gas inside of the lungs is going to amplify that sound. But there's a lot of other structures and kind of, mucus and stuff is all in there and whatever. So it kind of just gives it this resonant noise. But in those hollow organs, it's like you're hitting on a drum, right? So it will be booming and loud.
All right. Awesome. Good job, guys. Good job.
You ready for a 2-point pediatric nervous system question?
All right. We're ready.
Okay.
We are ready. So Team Cathy, everybody on board.
The nurse should provide what medication administration instructions to the parent of a child who has been diagnosed with ADHD? So what are we telling the caregivers about how to take the medicines for a child with ADHD?
Like when it should be given, that type of thing.
Yeah.
Okay. What do we tell the parents of a child who's going to be taking an ADHD medication? Because this teaching is super important to know. Yep, there it is.
Yes, you're both correct. So take it with or after meals in the morning to prevent insomnia. I also like that you said after meals, because one of the side effects of CNS stimulants is appetite suppression. And then that's how we also see that weight dropping off, right? Which is why she also said to monitor weight and height. So super duper important. Yeah. So yes. Oh my God, the insomnia is unbelievable. I take an ADHD medication and I tell you, I won't take it after 10 a.m. If I take it after 10 a.m., I'm going to be up until tomorrow. So it matters a lot.
Definitely a morning thing to do for sure.
Yes.
Okay. Awesome. Awesome job. Okay. Let's see. Then I'm going to ask you a question. And I can't play I play a hazard card on my turn next time, right?
Yeah. Yes.
Yeah. Okay. All right. That sounds good. All right. So you guys, I have a funds, practice, and skills question. And this is such an important question, y'all. Okay. Team Meris, Team Cathy, don't be answering this question. If the patient's next TPN bag will not be available on time, what type of fluid should the nurse administer until it arrives?
Got to know it. I guarantee you'll be asked a question on this at some point in your nursing school career. You gotta know.
Totally.
So think it through. What is TPN? And if you don't know, TPN is total parenteral nutrition, meaning that we are giving this patient all of their nutrition parenterally through their IV. Yes.
There it is.
Yes. So this is, yes, absolutely. This is the answer right here. A fluid containing dextrose. And your facility is going to have different guidelines on what that is. So it could be D10W, D5W, whatever it is, that's going to be up to your order set and your facility, but it's got to have dextrose in it because we don't want.
And it's usually 10 to 20%. So a lot of you saying D10, yeah, that's very typical. And that would be, that would be the right answer if that's like one of the choices when you have an exam. So,
but not like normal saline, lactated ringers, 3% saline, like none of that. because it doesn't have that all-important dextrose molecule to keep the brain functioning while we're waiting on that TPN.
Totally. So, you guys, Team Cathy, normally it would be our turn to answer a question, but instead, I'm thinking we play a hazard card on Team Meris. What do y'all think? Because it's just kind of fun to do that. So I've got a hazard card here from our nutrition deck, and it's an NPO. You know how much our patients love being NPO. Like, not at all. And it says
so much.
Come on, just some water or a cracker, anything. I'm starving. Why can't I just eat? For the third time today, you'll have to explain to Mr. Ship what NPO means and why he can't have anything to eat or drink. So,
poor Mr.
Ship. I know, right? And you got to make sure your whole team knows that he's NPO too, because he'll try to work over everybody who comes in the room, right?
You can't really tell, but the drawing is of a hand like this, going like this. No. And he's got like duct tape over his mouth so he won't eat or drink.
Yeah, it's super cute. Okay, so here's how this works, Team Meris. You have to answer this 3-point psych disorders question. I know, I saw it kind of coming up and I thought, oh, this is perfect time to give a hazard card to Team Meris. But anyway, if you answer it right, then you don't get any points, but you don't lose points. But if you don't answer right in the 1 minute, then you lose 4 points. Okay, here we go. Name 3 of the criteria for hospitalization of a patient with anorexia nervosa.
Oh my gosh. Y'all.
There's a list, and there's a big list. You have to
start typing. You don't have to get them all. Just start putting them, just when you think of one, put it in. So what are the criteria to hospitalize somebody who has anorexia nervosa? Not everybody who has anorexia nervosa needs a hospital admission. So how do we know who stays inpatient? Okay,
there's one. Blood pressure less than 50. Yep.
So their BMI is probably gonna be pretty low.
But you gotta be specific. You gotta be
pulse less than 60.
Well, we have heart rate under 50.
Okay. BMI under 18, they said.
Specific numbers, guys.
Severe electrolyte imbalance. Dehydration.
That's right. Electrolyte imbalances, you have 2.
Yeah. Amenorrhea. That's.
Yep. Okay, you got it. About 75% of ideal body weight. So you guys, man, I don't know when this ran out, but I was too busy looking at the card. Y'all might not have gotten it done in time, but I'll give it to you. Okay.
Okay.
All right. So it's any 3 of the following: electrolyte abnormalities, heart rate under 50 beats per minute, a systolic blood pressure under 90, arrhythmias. I think someone might have said that in there too.
Mm-hmm. Yep.
Temperature under 96 degrees Fahrenheit. Less than 75% of ideal body weight. So I know a lot of you are putting some BMI stuff out there. It's less than 75% of the ideal body weight. Body fat under 10%, and refusal to eat. Those are the hospitalization criteria for anorexia. So yeah, good job, guys.
A lot.
It was a lot. That's a tough one. But you know what that's going to show up on is a select all that applies type question. So you do have to kind of know those things, like the temperature, the blood pressure, like the heart rate. You kind of have to be familiar with those things, those hospitalization criteria.
And you got to be able to think critically too, because remember, your patients with anorexia nervosa are likely going to have a low body weight, are likely going to have a BMI less than 18 in some cases, and they may not qualify for hospital admission unless they meet that very specific criteria. If we are less than 75% of our ideal body weight based on height, right, then that's the criteria versus my BMI is 18, you know. So very, very specific. Gotta be on the lookout for that.
That's a tricky one. That's one
It
of the
is
things where
tricky.
you kind of have to like memorize those things and just really be ready to do that on a select all that applies type question. Okay.
Yeah.
Nice job, guys. How about, well, we got a little longer. I'll wait a little longer to do our next giveaway, but now,
now it's your
it's
turn to
all's
ask
turn
us again. Yep. But this
Unless
one
y'all
we can
want-
actually win points on.
Exactly. All right. We got a 2-point nutrition nursing practice question for Team Meris.
Okay.
So this is M through Z. If you're Team Cathy, don't answer this question. Okay. What nutritional guidance should be given to a patient with chronic kidney disease regarding their intake of sodium, potassium, and phosphorus?
Sodium, potassium, and phosphorus for a patient with chronic kidney disease.
What guidance do we need to give about those electrolytes?
What do we think?
Okay, we got, oh man, I keep forgetting to do this. Y'all got a little extra time. Okay, so low sodium, that's right. What about the other two? What about potassium and phosphorus?
Potassium and phosphorus. Watch food high in potassium because you want to.
Okay.
Yes.
Yeah, they did it.
Yeah,
so restriction of sodium, potassium, and phosphorus. Those things will in all likelihood be restricted for somebody with CKD. Now, protein, it varies. Okay, so protein intake may be restricted within a range, but we actually don't want it too low. We don't want it too high. And it really depends on whether the patient's getting dialysis or not. So with each exchange of dialysis, they lose protein. So someone who's getting dialysis will actually need more protein than someone who is not getting dialysis. So protein intake kind of varies depending on the individual, their GFR, and whether they're getting dialysis. But in all likelihood, potassium, phosphorus, and sodium are typically always restricted. So
yeah, absolutely.
All right.
So good.
They are.
You ready for your 2-point pharmacology nervous system question?
Yes. All right. Team Cathy.
Which lab value should the nurse monitor in a patient taking carbamazepine?
Okay.
Carbamazepine, what lab are we monitoring?
Okay.
What lab panel, I would say.
Yes, lab panel. So to answer this question, you got to know like a key side effect of carbamazepine, and that will tell us what we really need to monitor because of this side effect. No.
So you're
on the right track.
How would you measure that? Like what lab is that a part of, my friends?
Right. What panel?
Because it's not just the WBCs you need to be looking at, or the CBC. Complete blood count. Yes.
Yep. So a key side effect of carbamazepine is blood dyscrasias. So
blood dyscrasias.
Totally. That means we will have a decrease in red blood cells, white blood cells, platelets, right? Like everything. So,
I always think blood dyscrasia means your blood is crazy, right? Like all those values are just going to all be bad, right? So that's not good. So we got to watch that CBC.
Totally. So yeah, the whole panel. So good job. Awesome job. Okay. No, I'm asking you your question, aren't I? Yep. Okay. I got a 1 point. Unless you're going to play a hazard, are you holding off till you get a good?
So I was just looking, and I don't have any good ones to play a hazard on right now. So
okay, all right.
We'll save it for next time.
That's fine. I got a 1 point maternity. Okay. 48 hours after giving birth, a patient is eager to learn how to care for the newborn. What phase of maternal role attainment is the patient likely experiencing?
So remember, we have a couple of 3 phases of maternal role attainment. They have different names. There's a couple of different ones. Like there's like Some people call it this thing or that thing. So we have both of them listed. So we're talking about 48 hours after giving birth. That's a very important number there. And the new parent is eager. They want to take care of the baby. They want to learn how to care for them. Oh boy, this is a tough one, you guys. You're so close. Yes, taking hold, taking hold. There we go. We'll take that. Shannon.
Okay.
Taking
All
hold.
right. Sorry, I missed that one. Yes. Okay.
Yes.
Good.
Oh,
all right. So it's dependent/independent, or the taking hold phase. So
yes.
that's right.
So you'll see dependent-independent. So it's like I need you to help me, right? I'm still depending on you to take care of me. So I'm like, I think of dependent as like, I'm depending on you to take care of me, right? Like, because I just had a baby and I am not able to take care of myself. And then dependent, independent. So I still need you to help take care of me, but I also want to learn how to care for myself and the baby. And then the independent, now we are talking about, I can do this, right? I can take care of this baby by myself. Yeah.
Totally. Good job. Good job.
Good job, guys.
Okay. So let's have everyone who is interested in trying to win one of our dosage calculation workbooks, put in the comments, again, only one time, no repeat entries. Put in the comments, I love med math. I love med math, which you will after you get our dosage calculation workbook, because we kind of break it down so that it's really easy to learn all of the different calculations you need to, learn. And we do it like every calculation, we do multiple ways. We do dimensional analysis. We also do ratio and proportion. We do the formula method when we can, so that you can kind of pick the way that makes the most sense to you and just kind of follow that. So
yeah, because I'm a ratio and proportion gal. I don't do this dimensional analysis nonsense. It doesn't make sense up here. Cathy is all about dimensional analysis.
I love dimensional analysis.
We are both very smart, strong, capable nurses who, excelled in our field, and our brains work very different ways. So if you're struggling with med math, it doesn't have anything to do with like your ability to get it. You can get it. Sometimes it's that they're not teaching you in a manner that makes sense with how your brain wants to learn it. So we teach you 3 ways to solve every single problem. So no matter how your brain works, you can learn from this book.
And it's always like color coded. So if you're like dimensional analysis, you're always looking for the blue, like the blue box. And if you're ratio proportion, you're always looking for that green box, and formula method is that purple box. So it's really easy to kind of hone in on the way that makes the most sense to you. And that workbook comes with, I don't know, like 40 different videos. So I work through on my whiteboard every single example problem in that book, and I work it 3 different ways. So that is also, when you get the workbook, you get access to the videos where you can get that help. So I love math. I love dimensional analysis too, June. It's amazing, okay? Because you can do it all in like one huge equation. And your videos on the website for dimensional analysis, 10 out of 10. Yes, I love that so much. Yeah, no, and I dig, I dig ratio and proportion, and I have a much greater respect for formula method as well, because it's just a very quick and dirty way to like solve like more basic problems. If it's a little more complicated or not a traditional dosage calculation problem, you can't use it sometimes. But anyway, dimensional analysis is the most efficient way to solve a lot of those problems. So anyway, all right. That's really, and then, yeah, you guys are really sweet. So everybody entered. Nice. I know, everybody's really nice. We love coming to these things because everybody's so supportive and kind, and they tell us how our videos have helped and that they just passed the NCLEX and all that. And it
makes us so happy.
Awesome. Totally. Okay. I have the dependent independent. Was that our last one, the taking hold thing, or was it?
Yes.
What was it?
So it's my turn.
Yeah, so you're going to ask us a question now.
Yes. Okay. Team Cathy.
All right, Team Cathy.
4 peripheral pulses that can be assessed in a patient's lower extremity. Lower extremity pulses. 4 of them.
4 different types of pulses that we can palpate in the lower extremities. What are they? Just start typing. I know you guys can do it.
So popliteal, we'll take that.
Yep.
Pedal, dorsalis pedis.
Yeah.
Tibial,
Femoral.
I need another word for tibial. Yep, femoral will do.
Yep. Okay, yeah. Give us the other word for the tibial one.
Yep, one more word I need in tibial. Where?
Right. Oh, there it is.
Posterior
Posterior tibial.
So femoral, popliteal, posterior tibial, and dorsalis pedis. So FYI, in case those words all sound completely fake to you, femoral is going to be felt in the junction of the leg to the torso. Your popliteal is going to be behind the knee. That's the popliteal area there. Your posterior tibial is kind of felt like behind the medial malleolus, so like right behind that bump on the inner portion of the ankle, that's where the posterior tib is, and then dorsalis pedis is going to be on the top of the foot. Good job, guys.
Nice job, guys. Nice job. Okay, so I asked you the first question, then you asked me. Right? So we're even right now?
Yes, yep.
Okay. So maybe one more round back and forth.
Okay.
And then we'll announce our winner of the dosage calculation workbook. Okay.
Yeah, that works.
All right. I have a 2-point health assessment question for Team Meris. What term is used to describe an elevated fluid-filled skin lesion measuring greater than 1 centimeter?
Elevated fluid-filled lesion helps us to narrow it down. I have a health assessment video on this, and I gave you a way to remember the differences between these. So a papule is not going to be fluid filled. That's going to be
a solid
because it is elevated. It's going to be solid. So a pustule is a good guess because it is fluid filled, but that's filled with pus. And it's usually, so what size was it, Cathy?
It was greater than 1 centimeter.
So vesicle, you guys are close. There we go. Yep.
Yeah.
Oh, wait. Beulah. Yeah. Okay. So we've got 3 types of fluid filled lesions. Okay. We have pustules that are pus filled. We have vesicles that are very small. And then we've got a big old beulah. Okay. So vesicle, very small, right? Like less than 1. And then beulah, big old beulah. So that's your big fluid filled lesion. Like I always think of like, you know, those patients that got like a big, like a big blister from like a burn or something like that. You know, that's what I always think of, like that kind of size.
Totally.
You guys are so good.
Your internet's cutting out, I think, Meris, maybe slightly. Unless,
okay.
I think it's you, but I don't know. I can hear what you're saying for the most part, so I think it's okay.
Okay.
All right. Every once in a while, your face like free. I don't know. Is it Meris or is it me?
I'm sure it's me.
Okay. All right. So you're gonna ask us one more question.
Yes.
And then we'll count up our points.
Yes. All right. Peruvian gentry learned about beulah today for the first time. I love it. There we go. All right.
Nice.
Team Cathy, here is your 1-point nutrition foundations question. Which macronutrients provide 4 kilocalories of energy per gram?
Okay. So we have our 3 macronutrients, which 2 provide 4 calories per gram. And the other one provides 9 calories per gram. But 2 of them do 4. And which 2 are those?
Carbohydrates and proteins. You
guys
are too good.
Yep. Too good. And then fats are the 9 calories per gram. So sometimes you might get a question like, okay, a patient eats 5 grams of a fat. How many calories is that?
Or they
Right?
can do like, your patient had a sandwich containing 10 grams of carbs and 15 grams of protein and blah, blah, blah. How many kilocalories were consumed? Like, whatever. We had that. I don't know if you had them that intense, but we
Yeah.
did, where we had to know and calculate and blah, blah, blah.
Totally.
Yeah. So,
Totally.
yeah.
Totally.
It's not super common, but it does come up every now and then. Yeah.
So everybody answered every question we asked tonight, which is awesome, which is super awesome. So let us announce the winner of our dosage calculation workbook, and then we will add up our points and see if Team Meris or Team Cathy won tonight. So our dosage calculation winner tonight is Sarah Frerel. Sarah Frerel, and hopefully I'm pronouncing your last name right. But Sarah, when you get your dosage calculation workbook, if you can take a picture of it and send that to us, we would love to see your smiling face with your free dosage calculation workbook. So congratulations, Sarah. And super excited to hear how you like it. Hopefully you love it. All right, should we add up points? Did you already add up yours?
I added up. Yep. Katie says it helps so much. I promise. Yes, it totally does. It is awesome. I'm so glad you like it, Katie.
5, 7, 9, 10, 12. Okay, so you got, I'll double check it here. 3, 4, 5, 7, 9, 10, 12. I better do one more time. I'm doing my triple checks like every good nurse should do, right? So 3, 4, 5, 7, 9, 10. All right, 12 points for Team Meris.
13 points for Team Cathy.
How many?
13.
Oh! 13 points. You know what that means, y'all. I have 2 trophies, actually. I've got this fun one from NurseCon that I got. I'm like trying to build up to Meris's collection of trophies.
It's true.
But here,
goat.
Yes, greatest of all time. So,
congratulations!
Oh, yeah, Team Cathy, Team Cathy. So,
congratulations, Team Cathy.
Well
deserved.
Thank you. I'd like to thank all the people out there, all the A through L people.
I'd like to thank the NCSBN.
Exactly. Oh, that was so fun, guys.
Don't forget about this, okay? If you didn't win the planner or the dose calc workbook, you can still get it for free. You can get either the planner or the dose calc workbook and 6 months of membership when you get the Ultimate Nursing School Survival Kit. That is money, y'all. Like, that is a good savings. Like,
oh, it's a huge deal. And if you guys and if you guys aren't familiar with the membership, our membership has all of our core content videos without ads. Okay, so it's like well over 600 videos, so you don't have to watch any ads. We have over 1,000 review questions. We have, what else do we have on there?
We've got cram courses. So if you like, I've got my final exam, I've got my ATI proctored, I've got whatever, you can go watch like an hour-long video of me and or Cathy talking about whatever it is. And we are only hitting the highest of the highlights, right? Like just like the most testable stuff, which we always give you the most testable, but this is like the most of the most.
Oh, yeah.
Right?
Oh,
like,
yeah.
So
totally.
We've got contact hours. So if you're a working nurse and you need some, I mean, I just had to renew my nursing license for October 31st. It expires. So I just had to renew. If you need some contact hours, we've got contact hours for you for your continuing education. What else do we have on there? We've got more stuff. NCLEX review course, where we talk about test taking strategies, studying tips, acid-base fluid electrolyte review, all of that stuff, plus all the cram courses. We've got a lot on there for you.
Oh, it's a lot. And if you guys are studying for NCLEX, those cram courses are a great review for NCLEX as well. Like, just to make sure you've got those super critical concepts down in time for your test. So, Yeah, so the link, so you go to leveluprn.com. Leveluprn.com. That's where you can find all of our flashcards, our membership, everything. And our membership is actually really, really affordable in general. It's $10 a month. It is so much value for that money. Like, it is a crazy good deal. But again, if you get the kit, the nursing ultimate nursing school survival kit, you get 6 months of membership for free, plus the dose calc or the planner. So it's a pretty smoking deal. So if you're getting ready to go to school, it's great.
I put the direct link. Also, I put leveluprn.com in the comments, but I also grabbed the link to membership directly if you're just looking to go there. So that should get you there.
Totally. And we're going to be back. We're doing this again. What, I think August 9th. Am I thinking that right? Let me look.
We are back August 9th. Same time. So it's going to be Wednesday, August 9th, 7 o'clock Eastern, 4 o'clock, the other one, Pacific. I was like, what? Oh my God.
Pacific.
Well, it's a long day at the ER.
The other people. The people on the West Coast. Anyway, we're at 4 o'clock. So anyway, hope you guys can.
We're doing something different, right? Aren't we doing something different that time? Aren't we doing So I think, correct me if I'm wrong, but I believe that time we will be playing Nurse Squad. We'll be doing similar to the NCLEX style where we had it like this, but it'll be just fundamentals and health assessment. So if you are starting out, or maybe you're going into your specialties and you want to review that kind of foundational stuff, we're going to be doing fundamentals and health assessment combined together next time.
Yep,
I'm so
totally.
excited.
It'll be
I love
great.
those subjects.
Oh yeah. Well, and those subjects, like, you got to know that stuff all the way through nursing school, not just at the beginning, and you have to know it for the NCLEX. So it's good for new students, people just starting in nursing school, but it's good. It's a good reminder for everyone else as well. Like, when you take leadership, which is like one of the last classes you take, 80% of that leadership class is fundamentals. It's like you have to know your funds, and there's just a lot of information to know for funds as well. So
I truly believe that the majority of NCLEX comes down to fundamentals, because a lot of the answers, you can suss out the answer if you know your fundamentals strongly. So even when I didn't know the answer, I could always come back to those like foundational things. Don't leave your patient. If I had to do one thing and leave the room and never come back, what would it be? Like those sorts of things. And so it really, like, having a strong fundamental knowledge is going to help you so much in every class and on NCLEX. Katie, I don't have a video on tips for new grad ER nurses specifically, but I love that idea, and I could definitely make some content for you along those lines. So thank you for the idea, and I totally will. I'll get back to you on that.
Oh, no, that'd be amazing. So yeah, Meris is a certified ER and emergency and trauma nurse. So if she puts together a video on tips, then that is something you should definitely watch.
Maybe we'll do a little TikTok series on some new grad tips. Yeah, because I actually have a list in my phone of tips for ER nurses, because we get this question a lot.
You should do it.
I'll
totally.
Do that. Well, thanks for the idea, Katie.
All right. Nice. All right, everybody, thank you so much for joining us tonight, and good luck if you're studying for the NCLEX or if you're in classes, and we'll see you next time. Okay, guys, take care.
Bye, guys.
Bye.